5-year-old patient is diagnosed with GERD, gastroesophageal reflux disease, and is being discharged with education about lifestyle changes. The nurse reinforce teaching to help prevent reflux symptoms. Which instruction should the nurse include? And we know GERD is a chronic condition in which like stomach acid or bile, flow back into the esophagus. So we just need to do that, and it can irritate the lining. So we are just now doing the teaching for the patient. Okay, what about A, guys? About lying down immediately after meal. Is this gonna be helpful? What about A? ACE? Yes. Yeah. Hi Sunny. Hi Pizza. Okay, A definitely, because if patient is gonna lie down immediately after the food or meal, gravity is gonna help to keep stomach acid down, and lying down can after eating especially allow acid to reflux into the esophagus. So that's why definitely. B, elevate the head of bed when sleeping. So same thing like how we talked right now. So A, B, C, E, yeah. Okay, because this one also reduce the effect of gravity, like if patient is lying down, but like if patient is sitting upside, in this condition gravity will help to reduce the chance of reflux, okay, especially while sleeping. Eat small frequent meal instead of large meal. Can that help? Because like if somebody is having large meal, it's gonna put more pressure on the stomach, and it will make patient more reflex. Okay, then patient will have more what we will say GERDs. Okay, so small meals are always preferable. Yeah. Drink peppermint tea after meal to improve digestion. Is it recommended? Yeah. Gil, that's the one they are saying eat small frequent meal instead of large meal. So we are not saying large meal, we are having small meal here. Okay, so definitely if we are having spearmint or peppermint tea, it actually relax down the lower esophageal sphincter. So that's why we don't recommend it one. Okay, so D actually can increase the symptom instead of decreasing, so it's not recommended. What about E? Limit caffeine, alcohol, chocolate intake. Can they increase the acid production? Yes. Okay, so because alcohol, caffeine and chocolate, they can increase the stomach acid production, and so definitely we're gonna limit that one. And what about F? Sleep flat on back to improve esophageal drainage. Do we need drainage? And sleeping back, flat on back is gonna help? No. Okay, gravity is gonna create more reflex over there. Yep, nice. Okay, let's move to question number 2. We're gonna keep going. Okay, a patient is prescribed omeprazole for chronic GERD. The nurse is reviewing medication teaching. Which point should be included? What kind of medication we have? Omeprazole. PPI. Yeah. So proton pump inhibitor like omeprazole, it is the basically that block the gastric parietal cells, and which are responsible to produce the stomach acid. So that's why it's lowering the stomach acid. So taking the medication 30 to 60 minutes before the first meal of day, is it gonna help? Yeah. What about A? A patient, yes, because this medicine is gonna take at least few time, half hour to 1 hour, to start creating the effect. So before meal is always preferable. Avoid crushing or chewing the capsule. Is it correct? B, yes. Yes, B is yes, because what's gonna happen, because it's encapsulated and special coating, because it prevent that from the stomach acid. So if we are crushing and chewing, the effectiveness of medication can actually decline. Okay, thank you Nero for following. Please guys keep double tapping. Report black terry stool to the provider. What about C? Ear med. Yeah. What about C, guys? Yes, because if somebody is taking proton pump inhibitor, especially for the long time, there is a actually complication, melena. It can be sign of GI bleeding, and any type of bleeding is not safe. So that's why we want to report that to the provider. Okay, this medication can be taken with or without food. D. Is it appropriate to take both side of meal, or are we gonna just take before the meal? No. Yeah, it's no, because we just discuss about like we need to take it before the meal at least 30 to 60 minutes. So it's not gonna make any effect if we are taking it without or after the meal. Okay, because food inside the stomach is already creating too much acid. What about E? Continue taking the medication even if symptoms improve. E. What can happen? Yes, yes. Because this omeprazole is one of the kind of medication that can be used for the long term, and if we are stopping it abruptly, it can cause the rebound effect. So we don't need to stop it instantly once symptom improves. Okay, if we want something like for instant results, antacids gonna help more rather than um, PPIs. What about juice for long-term therapy only if it is completely safe without monitoring? Hi JJ, good evening. Can we use it for long term? Yeah, yes, always monitoring is needed, because long term, we just discussed like it can long term use of PPI especially can lead to complication of bone fracture, C diff, and hypomagnesemia. So it always require the monitoring. So we're gonna incorrect this one. Let's move to question number 3. The nurse provides discharge instruction to patient taking over-the-counter antacid for GERD. Which patient statement indicate correct understanding? So we know antacid. We just discussed like antacid is gonna be instant helpful to neutralize the acid. It will provide the quick relief from heartburn, indigestion, but it can't prevent the further acid production. So let's see, I should avoid taking antacid within 1 hour of other medication. A, yes, yes to A, JJ, definitely. We discussed this option like in our pharma session also a couple of weeks ago, because especially calcium, magnesium, aluminium, like these reduce the absorption of medication. So that's why we don't want to take it within other medications time limit, because it will reduce the absorption and effect of those medication. Option B, if I take too many antacid, it might develop constipation or diarrhea. Can it be some side effect? Yes. Okay, so this one is the side effect that I clearly indicated into our pharma book also. Which kind of antacid can cause constipation, and which kind of antacid can produce diarrhea? Anyone? Not all of them produce diarrhea and constipation, but they have different. Which one is gonna cause constipation? So this answer is correct anyway. But anyone if want to save. So aluminium and calcium based antacid always cause constipation. Okay. And magnesium always cause diarrhea. So please remember that one, because that can be the side effect that you can get into the NCLEX, especially in the story or case study where patient is having antacid also. Okay, so aluminium and calcium. Thank you, Preet. Aluminium and calcium, they will cause constipation, and diarrhea will be produced by magnesium based. Alrighty, let's move to option C. Antacid will heal the irritation in my esophagus. Is it correct? What about C? Aluminium and calcium cause constipation. No. Okay, so this is not gonna heal anything in esophagus. It only gonna affect and neutralize the stomach acid. Yes, so aluminium and calcium gonna cause, and if overdosed they can cause the constipation, but magnesium will cause diarrhea. Okay, I can use antacid for quick relief of heartburn. Is it correct? Isn't it the main reason why we are giving the antacid? Yes, slow night, very slow night, sunflower. I know everyone might be busy. Yes. Okay, so this one is very, very important, and this is the expected desired result we want. Okay, so this is the primary function. What about E? If my symptom persist, I should notify my provider. What about E, guys? E, yes. Okay, because the thing is that, like, if after having the antacid still we are having medication symptoms of acid reflux, then that medication is not working. Okay, there is some other issue is going on, so it can be very serious, so might need the different plan. So E is correct. Okay guys, let's move to question number 4, and we only need one subscriber on YouTube to make it 200. Okay, so we need one to go and subscribe YouTube. A patient with history of PUD, peptic ulcer disease, is admitted with severe abdominal pain, rigid abdomen, and absent bowel sounds. Which complication should the nurse suspect? Select all that apply. So we know what is peptic ulcer. Peptic ulcer is usually sores and ulcer in lining of stomach and duodenum. Yeah, it can cause bleeding, incomplication, perforation, and can sometimes cause obstruction also. So which complications? ABC, yeah, perforation. So what will be the sign of abdominal perforation? We have done that, guys. We have done that in our class about maternal health. What kind of hallmark sign we will see in abdominal perforation when we have perforated ulcer? Hi Jocelyn. What kind of symptoms we are expecting from patient? Rigid abdomen. Yes. Okay, so all these sign guys, is sometime the question answer is there. So rigid abdomen and severe pain, but abdomen like bored, like very hard, rigid, that will be the hallmark sign of perforation. Peritonitis, we done peritonitis yesterday. Yeah, can it be the complication of PUD? What about B, guys? Yes, because we are saying it can perforate. So when it have the perforation, then the content can leak to the peritoneal cavity. okay, abdominal cavity, and that will cause the inflammation of peritoneum. So peritonitis definitely can happen. What about GI hemorrhage, gastrointestinal hemorrhage? Yes, this is one of the most common, okay, this is very common complication of PGD. D, gastric outlet obstruction. Is there any reason why gastric ulcer can cause obstruction? No, actually, yes, because when the ulcer can cause swelling, obstruction, yes, yeah, it can cause swelling, it can cause scarring of the tissue, it can block the food from stomach to small intestines. So definitely, and can it cause appendicitis? Yeah, can it cause appendicitis? No, no, okay. Appendicitis have different symptoms, especially the pain will start from the navel and then it will move from the right lower abdomen, okay, and you will not see rigid abdomen in that one. And appendix with, yeah, absent ball sound says a lot, definitely, okay, you will not have that many absent ball sound in that one. All good, guys. Let's move to question number 5. We will keep going on. Keep double tapping the screen and sharing with your friends. A patient with PUD again is prescribed sucralfate. The nurse is reinforcing teaching about this medication. Which statement indicate correct understanding? Okay, so what kind of medication we have? Sucralfate, what kind of medication? Why we give this medication to patient? Anyone? Iron? No. So this is the medication usually we prescribe or administer to patient to prevent and treat the GI ulcers, okay, especially the duodenal one. Wherever there, yes, gastro protection definitely, because it will form a protective barrier around the epithelial lining where especially we have the injury. So yeah, okay, I should take this medication on empty stomach. um so the Amir is, yes, it will coat it down. It's multiple choice, it's not multiple choice, it's SATA. So ABD, let's see, A is definitely yes, because then if we are taking this medication on empty stomach, there is higher chances of that medication will bind to the ulcer, because otherwise if we are taking it with the meal, then it can mix up with the meal and it will have less surface area to attach to, okay. So A is definitely correct. What about B, guys? This medication coat my stomach lining to protect it. Is it correct understanding? Is that's the, yes, okay. So B is correct because that is the desired effect, that is the mode of action for that medication. Yeah. What about C? I should avoid taking antacid 30 minutes before and after sucralfate. Yes, C, yes. See, yes, because we just discussed in last question that antacid can reduce the absorption of medications. Okay, and they can also interfere with the binding ability, so they will make it less effective. Okay, so we are not gonna give it with antacid. This medication reduce stomach acid production. Does it have any effect on parietal cell? It's not D. Yeah, correct. It it has not any effect on parietal cell. Proton pump inhibitor are the one that will reduce the production of acid. I may be prescribed this along with other ulcer medication. Is correct understanding? What about E, guys? Yes, there is possibility. Yeah, because patient is saying maybe. Okay, there is possibility. So like it can be given with other medication that can reduce the acid production, so that will improve the rapid healing. Because if there is too much acid also, that can increase the chances of ulcer. Yeah, yeah. So that's why it can be prescribed along with other medications. So E is correct. Okay, let's move to question number 6. Like PPIs, Jasmina, like PPIs can be given. Yeah, it depends. Like a meprazole just to reduce the acid production, but depend like what kind of ulcer and where patient is having the ulcer. Whether it's the whether it's in the stomach or duodenum. Yeah, so that's why. Quadrant therapy. Yeah. A patient is started on triple therapy for H. pylori related PUD, omeprazole, clarithromycin, amoxicillin. Which nursing consideration apply? Instruct the patient to complete the full course of antibiotic always. We don't want patient to stop in the middle. What will happen? Yes, because it will cause the antibiotic resistant. Yeah. What about B? Inform the patient that diarrhea and nausea may occur. Is it common side effect of antibiotics? B, yes, definitely. Okay. What about C, guys? Tell the patient to stop the medication if symptoms improve. With H. pylori, do we wanna stop the medication once symptom improve, or we gonna keep going? Yeah, we wanna keep going. Okay. So C is wrong. C, no. Remind the patient to avoid alcohol while on antibiotic. Is that correct? What will happen if patient is having? Yes, because it can cause the side effect like nausea, vomiting. We know alcohol is gastric or bowel irritant, so definitely. Okay, it can increase the side effect. Encourage taking medication at same time each day. Yeah. What about E, guys? Is it important to have medication on same time? Yes. Yeah. Okay, because it will maximize the effectiveness. We will have a proper amount of drug in the blood all the time. Okay, so that's nice. Let's move to question number 7. Guys, keep double tapping. Thank you. A patient with a history of cirrhosis is admitted with vomiting of bright red blood. Which nursing intervention take priority? Thank you, Rosa. So where we can have that vomiting of bright red, it can be from esophagus, can be from stomach, it can be from duodenum. Okay, so maintain a patent airway. Airway is always the priority. ABC, yes. So we need to make sure like we have patent airway available. Insert a large bore IV line for fluid and blood replacement. What about B? Do you think we need to administer blood or fluid rapidly? Yes. Okay, there can be chances like a patient can bleed out fast. So we need to have this option available if we need to transfuse the blood. What about C? I think when it's cirrhosis and patient is already vomiting blood, he's not stable on that time, so that's why we will go with it. C, monitor vital sign frequently. Yes, tachycardia, hypotension, O2 decrease, saturation can be there. Okay, so we need to monitor. um, what about D, guys? Place the patient in supine position. So if patient is in supine position, what's gonna happen? What can happen? Aspiration. Thank you, Kemi. Yes, JJ. Okay, so this is wrong. So we don't want that one. Okay, because patient is already vomiting. We will put it on the side. Yeah, we will put it on the side. Prepare for possible endoscopic intervention. E. Is it gonna happen? Help us to diagnose where is the bleeding? Possible, yes. Yes, Amir, the question in context of question we can answer. Okay, this is the stage, this is severe stage. Okay, already, and this is only saying prepare, this is not saying to do. Okay, so when we do for the NCLEX, we need to stay within the context of the questions. Okay, so that's the main important. When we say ayama, this is SATA, this is select all that applies, so we need to select. If they will say select which one is the priority, which one only, like if there is MCQ, so we will definitely do the airway only. Okay, but we are gonna do this one also. So endoscopic prepare, because it's gonna help us to diagnose, and this is the primary method of diagnosing, just to check like what's happening and then treating. Okay, so we need to be ready, and we can expect that order from the doctor or provider. Yeah, because otherwise lot of we can say lot of things can happen with this patient. So our main goal is, if we are just here to learn for NCLEX and SEN exams, then our main focus is to stay within the question. Definitely there is hundred of other things that can happen with this patient. Okay, the nurse review lab result for a patient with an upper GI bleed. Which finding would be expected? Select all that apply. And that's the another thing. Like we don't need to. I know sometimes we have a lot of knowledge, and sometimes we have studied very hard disease that we wanna put it in there. We don't need to do that. Okay, so like if now patient having upper GI bleed, we just need to know what can happen there. Okay, yeah, no, all good, all good. Ayama, decrease hemoglobin hemocrit. Upper GI bleeding, do we see decrease in hemoglobin and hemocrit value? Yes, yes. Okay, this is direct result of blood loss. That's why we are decreasing, having less hemoglobin and low hemocrit value. Ele- elevated blood urea nitrogen. What about B? Key bleed. Yes. What about B, guys? B, yes, no, no. Actually, there will be blood urea nitrogen. Actually, it can increase. Okay, so blood in the GI tract is digested. Okay, so we are having now upper GI bleed. So where it's gonna go? It's gonna go to the lower GI tract also. It's gonna get digested, and when it's digested, those protein are gonna break down into the urea. Okay, so that's why you can expect some level of elevated BUN. The creatinine will be less. Okay, especially with normal creatinine, but patient is not only vomiting, it can go down. Okay, so that's why you can see BUN over there. Perfusion, kidney function, JJ, yeah, but like that's gonna happen later if there is too much accumulation. Decrease platelet count. What about C? Yeah, later. Um, Actually, we don't see decreased platelet count in upper GI bleed, especially if, yeah, they are bleeding, but like we don't know how much they are bleeding. Uh, yes, Jashmina, they both can do, as long as the blood is getting digested and the protein is converted into nitrogenous waste. Okay. um, if somebody is coming with the liver disease, they can have low platelet count, but like if somebody is just coming with normal upper GI bleed, so they haven't said that here, like if the patient is with cirrhosis. Okay, so if in this question they will say nurse reviewing lab result for a patient with an upper GI bleed in cirrhosis patient, or like, then definitely you will have decreased platelet count. There is chances. But if the question just saying upper GI bleed, we don't know the reason. We don't know what's happening over there. So there can't, it's not always decrease. Okay. Make sure why we are saying this no, because it can't, it's not then typically a right answer for every patient. Okay, so C is actually incorrect. It can reduce if they will say like somebody is coming with liver disease, because they can have, but decreased platelet count is not direct result of GI bleed. Okay, so make sure we just think according to what we got. Elevated INR and PT. Why we need to have elevated INR PT in here? Is it correct or incorrect? If the platelet is okay, so no, can't clot. No, like, okay, so that's the thing. Like, again, it can be elevated only if patient is on the blood thinner, or if patient is having the liver disease again. Okay, so we didn't had any information about liver disease, about any like consideration, like whether patient is on the warfarin or heparin, like that. Otherwise, that's why we need to think, otherwise we don't need to. Okay, so actually D is wrong also. Yeah, so if somebody is having less if somebody is having bleeding, it can't just increase the INR. We need those medication. What about elevated white blood cell count? What about white blood cell count? Yeah, no WBC increase. Yes. Okay. um yeah, so this is wrong also. Okay, so decrease platelet count. Okay, usually what happened? Yeah, Jashmina, we are gonna talk about what happened to thrombocytes. Yeah, what happened? What is the role of platelets? Cause like it depend how much bleeding is going on, but like the platelet will go and they will detect where is the bleeding, where is the vessel is injured, and then it will release the wall release from like the chemical signal over there. But that signal is gonna attract all the platelet on that site, so they can adhere to the that vessels, they can adhere, and then they can cause thrombus, yeah, producing clotting factor, and then plug formation happens. So it's not typically like what will happen to platelet. Like, why elevated BUN? Because a patient is with upper GI bleed, that GI bleeding can go into that can be digested. The once blood is getting digested, then those protein that in the blood will get converted into the nitrogenous waste. Okay, so when they convert into that waste, it will increase the BUN. Thank you, GT. Yeah. Okay. So platelet doesn't need to be decreased all the time unless if somebody will. Yeah. Amir, but like, yeah, it will happen in later stage. Yeah. Welcome, guys. Okay, let's move to. We're gonna do two more question and then we are gonna have 2 minute break and then we can move to another 10. The provider prescribe octreotide for a patient with bleeding esophageal varices. The nurse should monitor for which effect. So now we are giving this medication also to reduce the bleeding. What we need to know, how it's gonna help. Just say what kind of medication we have. Octreotide. What kind of medication it is? Thank you guys for following. Please keep double tapping. Really appreciate. Bradycardia. Yes, it can cause bradycardia. Why it can cause bradycardia? Yeah. Yeah, it is for somatostatin because this is actually mimicking the action of somatostatin. Okay, and that's why we need to know what somatostatin cause. Because that one work on most of the hormones. So primary action will be somatostatin is inhibitory hormone. If we know inhibitory hormones, yes, that will inhibit the growth hormone, that will inhibit the most of the endocrine, like gastrin, serotonin, insulin, glucagon, VIP, TSH, yeah, everything. And then it will also reduce. So somatostatin reduce everything. We need to know that. Okay, it will reduce the amount of fluid, reduce the amount of electrolyte that will get absorbed into the intestine from the intestine. Yes. Okay. Yeah, acromegaly in a uh, what we say gigantism or acromegaly, it is commonly given because there is excessive production of growth hormone. So that's why somatostatin is octreotide, because this is gonna mimic the action of somatostatin. So when we will give this medication, it will reduce the production of growth hormone, and when that will happen, then you're gonna see its effectiveness into the acromegaly and uh, gigantism. Yeah. So somatostatin, it is a blocker. Yes, somatostatin is a inhibitory hormone. Okay, let's go to the answers. Decrease portal venous pressure. Okay, now we need to know whether it how it decrease the portal venous pressure. Yes, it does do that. It does a because it cause vasoconstriction. Okay, not always vasodilation. Especially in the subclenching circulation, it will cause vasoconstriction that will reduce the blood flow to the liver. Okay, because now less blood flowing from the uh, supplanting artery to the portal vein, and that's why you will have less portal venous pressure. Okay, and that's why it reduce the effect of varicose vein bleeding. Okay, venous bleeding over there. Reduce GI bleeding, we already talk about that. It is the therapeutic B, yes, because this one is the therapeutic effect. That's why we are giving this medication. That's why we are giving, and this is the expected and desired result. Okay, so B is correct. What about C, guys? Bradycardia. Is C correct? C, yes. Low vaso, no. Okay, C is no, because it is one of the side effect. Okay, this one we need to monitor. It is no, uh, but we can monitor actually its side effect. Yeah, the nurse should monitor for which effect. Okay, we will monitor bradycardia also. Okay, because if it will cause too much vasoconstriction, it can do that. And what about hyperglycemia or hypoglycemia? And we just learned that like it work as a somatostatin. Somatostatin is inhibitory hormone. That hormone is definitely gonna affect the insulin and glucagon, and depending upon which hormone it is affecting more, whether it's insulin or glucagon, it can cause hyperglycemia or hypoglycemia. Okay, so it can cause both effect. Okay, what about E? Severe constipation as main side effect. Is it no? Okay, so understand the option also, please. Okay, is severe constipation is main side effect? Yes, MJ, definitely I will explain. I was saying because octreotide is in somatostatin, mimic the symptom effect of somatostatin. Okay, and that's why somatostatin is inhibitory hormone. So when we will give the octreotide, it will inhibit the insulin, it will inhibit the glucagon, it will inhibit all those hormone where somatostatin works. And that's why if it will inhibit insulin more, then what will happen? Hyperglycemia. If it will inhibit the glucagon, then it will cause like opposite side effect. Yeah. So if insulin is inhibited, then it's gonna cause hyperglycemia because there is too much glucagon production, and insulin can't transport enough glucose from blood to the cells. But if it will inhibit the glucagon, then we can have hypoglycemia. Yes, it block the production of hormones. Yes. Okay. Yeah. And severe constipation as main side effect? No, this is not the side effect. You guys can have diarrhea, constipation like that, but it's not the one of the side effect. It is one of the side effect, not main side effect. Okay, especially severe. Okay, let's move to last question for before break. Okay. A patient is admitted with acute hepatitis A. Which infection control measure are appropriate? 10. Question number 10. Amir, we are staying within the context of question, okay? If they are giving the gallstone here, definitely I will talk about the gallstone. So sorry about that. If we will do the pharma, then we will talk about everything. But we are just doing the question answer and options. Okay. Otherwise, it cause lot of stuff. It cause infection. It cause blood sugar. It cause heart problem. It can cause the rhythm abnormalities. It can cause fat malabsorption. So these are the things. There will be like 10 more side effect. Okay, so that's why we are just talking about questions. Yeah. Okay. Um, a patient is admitted with acute hepatitis A. Which infection control measure are appropriate? Select all that apply. Place the patient in private room if incontinent. So we know hepatitis A is viral infection, and it does happen with the fecal oral route. So it can be cause contamination from food and water. So is A correct? Yes, because it can incontinence can increase the transmission from one person to other. So private room is definitely gonna help. What about B, guys? Use contact precaution for stool contamination. Is it necessary to use the contact precaution? Yes. Okay, so we will have the contact precaution. We will avoid direct contact with feces. Yeah. If we are doing the care. C. Educate staff about blood-borne transmission precaution. So is hepatitis A blood-borne illness? No. Okay, this is the thing, like we need to teach only. We will definitely educate them about the fecal oral route. Okay, so bloodborne, because we will be careful. They are not gonna do anything with blood over there in the hospital or outside, and they are not transmitting blood to each other. So that's why we only need to teach necessary stuff. Um, Hepatitis B and C are only bloodborne. Yes, Amir. Encourage good hand hygiene after using the toilet. What about D, guys? Thank you guys for following. Keep double tapping. What about D? Yes, hand hygiene is most important because it is the fecal oral again. Yes, C is wrong, B poop, because it's bloodborne education. So that's why we don't need to teach that one. In context of hepatitis A. Okay. Because if we are just teaching about blood-borne transmission precaution, then you might will not teach about the fecal oral, because if they will say blood-borne or fecal oral, then we can say yes, but they are now specifying it to blood-borne only. Okay, so that's why we need to teach about hand hygiene. We need to teach about contact precautions also. So that's why we can actually make it wrong. So this is wrong. Okay, and the patient can share utensil and food with family. What about E? Can it be shared with food? No. Yes. Okay. Yeah, so we can't share utensils and you can't share food because it can transmit also, and uh, you don't know like whether somebody is properly washing the hand or not. Okay, and usually when you share food also, people just touch everywhere. So we wanna eliminate until it is working on and treating, then we need to eliminate that. Okay, because this is the one of the education's point. It can transmit through.